It is July 2023, and here we are again for another episode of CFP Distilled, where we take the journal and distill it down to what you need to know for your clinical practice.
And what do we start with? We start off with a cover critique. It looks like family practice Jenga. Not a lot of thought or energy went into this cover.
Yeah, I'm gonna. Last month's was amazing, but this month's looks like it was made in like Microsoft Word 95.
I don't know if I would set up foundations of the family practice with Jenga.
Like,
I don't know.
We
It
got a
only
big
falls apart at the end.
stick of bubble gum on the bottom holding everything up.
I don't know.
This one's just not gonna stick.
There's always hope for next month.
So we're doing a bit of a different format this month for the July CFP Distilled, thanks to your feedback. So we're gonna take a look at this in real time and analyze the articles in a bit longer form.
So let's start. Truth about omega-3s. So this I didn't know. I knew, yeah, fish, you're like, oh, it's high in omega-3s. Eat a little bit more fish, get rid of your heart attack risk. But in reality, they come from marine or aquatic microalgae.
Exactly. So the fish are eating the algae, and then we eat the fish, and then our omega-3 levels go up, and we don't have as many heart attacks.
You could try to cut out the middle fish or the middleman.
The thing that blew me away is that a lot of this is really over the top. We don't actually need to be taking omega-3 pills.
Yeah, there's little evidence for primary prevention in CVD. Now, supplementation could be considered in those who have hypertriglyceridemia or who maybe don't eat a lot of fish.
So you got a really small population of people that this is going to benefit.
Yeah, people who don't eat sushi.
You hit the nail on the head there. That's the recommendation for most people. If you want the benefit, eat more fish. 2 servings of oily fish per week is going to be enough for most people.
Oily fish. How do you decide if a fish is oily or not?
Haven't you seen that episode of The Simpsons? You take the food and you smear it on a piece of paper, and then if you can see through it, it's oily enough.
That's like an actual text, isn't it?
Yeah.
I don't know if that's environmentally sensitive, though, to be using.
We'll test that. We'll get back to you on that one.
Okay. In patients who are appropriately like you're on a statin, then do you need omega-3s? No. That's what.
Yeah, and a lot of the studies were done back before statins were done. So that's one of the things I loved about this article is they break the evidence down into the older pre-statin articles and then the newer, more relevant ones.
Okay. Fish oil supplementation can no longer be recommended. Now, here's the other question. If you ever get like dry fish at a restaurant, is that because they took the fish oil out for supplements?
They sucked it out and spit it into a container, put it into capsules.
How do you oil a fish?
How do you oil a fish?
Oil a fish?
Every 5,000 kilometers. So what's the next article you wanted to talk about from the July 2023?
The next one is reducing the death rattle. I had a patient this morning doing palliative care rounds in the hospital, and he was starting to get a little bit of that death rattle. So these are terminal respiratory secretions.
It's late now. So if you want to stop the death rattle, that's really reactive, and we want to be more proactive is what this article is saying.
So the solution is the prophylactic treatment with scopolamine butyl bromide. So earlier, I think, is the bottom line. Potentially earlier for these patients, dry out those secretions. I mean, it's often more distressing for the family members, I find, than the patients themselves.
It's true. They've considered this really closely and carefully. Does it actually distress the patients? Obviously, it's challenging to do that study, but the theory is you're right. We're treating the family.
Yeah. So it's that holistic care. I think it shows up in SUS, where you got to be thinking about not only the patient that's there, but what's the effect on the family members, everyone who's connected.
It's fascinating if you take a look at how should you prepare for the exam, because you may not be doing obstetrics, gynecology, you may not be doing palliative care, but you still have to know that it's in the 105 topics. So know the common end of life complications. Death rattle is a good one to know.
Now, this one, you mentioned this one to me. I think you texted me about it. You were so excited, and I was like, Simon, let's talk about something else. But
this blew me away.
Why were you so excited you texted me about pyogenic granulomas?
Well, first of all, what better to talk to your friends about than pyogenic granulomas? And secondly, the treatment for pyogenic granuloma is sitting on your kitchen table.
What's on your kitchen table?
Oh, there's a lot of stuff on my kitchen table. We got
pepper?
We got
ketchup, sriracha sauce, sriracha sauce on a pyogenic granuloma.
The mess from the kids, the fruit bowl. Yeah. With my 2-year-old, he takes a bite out of every apple and then puts them back in the fruit bowl.
Is caring.
Yeah. When it comes to pyogenic granuloma, I'm talking about the salt shaker.
I thought you were treating your hypertension. Shouldn't you not have salt on your table?
We used to cauterize these. We used to excise these perhaps. They bleed a lot. They're really irritating. So
yeah, I mean, I used to excise them, freeze them with like a silver nitrate stick, but you're saying just salt them.
Yeah, so you can make a little bandage island, use your scissors. We'll put up a picture of that on the screen for you. And you can see what you do is you put salt in that little well, in that cavity.
Yeah.
Tape it down for 2 weeks.
That's it. Sprinkled it. I just think it's gonna be weird when you ask your nursing staff to like go to the lunchroom and like give me some salt and you're salting a patient's finger.
Salting a patient. Honestly, if you're putting salt on a patient in the hospital, I think the nurses are going to start to doubt your competence. They're going to be like, are you like preparing to eat your patient?
Every day, salt application occlusion daily for 14 days. So in the morning, have your breakfast cereal, you have your eggs, bit of salt on the eggs,
Bit
salt
of salt on
the
your
finger,
pyogenic
cover it
granuloma.
over, and that's it. And it's gone.
Yet again, from the CFP Journal, something that feels like malpractice. Last month, we were looking at pneumonia treatment, duration down to 3 days. This month, pyogenic granuloma. Turns out just need to season it a bit more.
Seasoning. Season your patients.
We hope you've enjoyed this new and improved edition of CFP Distilled. Send us your feedback. We love to get those emails. And this is the July 2023 CFP Distilled. Not only do we talk about the clinically relevant pearls, what else do we talk about in CFP Distilled?
We talk about exam tips to get you ready for the SUs and the SAMPs, distill it down to what you need to know for exam success.
So we're really excited to see you in Toronto in August 2023, and tickets are on sale now if you want to come join us in the spring. We got some great cities: Vancouver, Calgary, Montreal, going back to Montreal, and where else are we going?
Las Vegas once again. We had an incredible time last year, a great way to kickstart your studying, be the first person in your program or group to have done a complete review of the 105 topics in January.
Yeah, sign up now while the early bird rate is still on. We'll see you in Vegas.